Discussing your results with your children. Sharing information about hereditary cancer with your children, whether they are adults or minors, can be difficult. While it may be natural for parents to want to protect their children from difficult topics, children are already exposed to the disruption that cancer causes in their families. For example, they can see for themselves that family members are undergoing increased screening, treatment, or surgery. They may have experienced the loss of a family member to cancer. Delaying the conversation may compromise trust. Without an explanation they understand, young children form their own beliefs, which can be based on misinformation. These misconceptions can be difficult to resolve later. Although some children may initially find the information upsetting, it is almost always a temporary feeling. What's more, it is common for children to overhear discussions, either between their parents or between other family members. Children may feel isolated, confused, and uncertain if they can't talk to you about how they feel. Such discussions with your children may or may not be planned. Often, information is shared because of a major event like a diagnosis or plans for a risk reduction surgery. The conversation may take place in stages over time. You don't have to say everything in the first sitting, and the conversation doesn't have to be perfect. At what age should you talk about it? Because each child and each family's situation and needs are unique, there is no specific age for giving your children information about genetics. It may be helpful to consult a genetic counselor, therapist, or other healthcare professional who has experience in this field. There are several resources available regarding the type of information to discuss based on the child's age and personality. For more information on this subject, please visit the Quebec Breast Cancer Foundation website. However, it is recommended that you discuss genetics with your daughters before they reach age 25 and with your sons before they are 35, since some screenings begin at these ages. For young people whose family members have been diagnosed with breast or ovarian cancer in their mid-20s, discussions about familial genetic predisposition should take place even earlier. Medicine and genetics are scientific fields that are constantly evolving. When your child reaches the age of majority, he or she may have access to more effective recommendations and prevention measures than those currently available. What are the benefits of talking to your children about your results? Your children may have more time to adjust to the information and integrate it into their self-image. They may better understand that they are not responsible for the emotions you are experiencing. They may be better prepared if a family member ever has cancer, needs to be screened frequently, or has preventive surgery to reduce their risk of cancer. They would be better informed when making a current or future medical decision, for example, deciding to take birth control pills. Knowing that their parent is not carrying the familial genetic variant may make a child feel relieved of not being at increased risk of developing cancer, despite what might be a significant family history. Some suggestions for talking with your children. Wait to be ready to have the discussion. When the time comes, being ready will help you stay calm and hear your child's concerns. Suggestions include taking time to understand the medical and genetic facts for yourself and your family. Feel confident and emotionally ready to share information with your children and to manage their reactions. Keep it simple. Children ask specific questions. You can answer without telling them everything you know. Some answers can wait. Some questions don't have answers. I don't know is an acceptable answer. Reassure your children about their own safety and health as well as your own. A positive test result does not mean that you will necessarily get cancer. You will keep them informed of your health status. Give children time to understand and ask questions, and then answer them as they arise. Respect your child's wish not to ask questions or talk about it. Teenagers may prefer to do their own research online. Check if your children have understood by asking what they have learned. Your questions will help correct any false beliefs, address concerns, and broach more difficult topics that your children may not want to talk about.